Hi all, thank you very much for being here. My name is Ben Morano. I'm a first-year MPA candidate at the Fels Institute of Government.
Hi everybody, my name is Michael Shaw. I'm an undergrad in the business school and the engineering school.
Hi, my name is Chris Arsh. I'm a PhD candidate in biochemistry and biophysics in the School of Medicine.
Hi everyone, my name is Tom Liu. I'm a MD candidate at the School of Medicine. And I want to start by asking you guys to think back to your week. How many times did you see a fellow Philadelphian light up a cigarette? Statistically, about 1 in 4 people. Smoking is a huge problem in Philadelphia. In fact, Philly has the highest smoking rate among the 10 largest cities in the US. What does this mean? Well, for one, it means that smoking has devastating effects on the health of our neighbors. Smoking causes about 1 in 5 deaths in Philadelphia, or about 2,100 per year. That means smoking kills more people than homicide, AIDS, car accidents, diabetes, and illegal drugs combined. In addition to these health effects, smoking also has crippling effects on our local economy. The Philadelphia Department of Public Health estimates that smoking costs the local economy over $700 million a year from productivity losses alone. Now, the city has recognized this, and they've implemented a number of initiatives to try to bring down the smoking rate, including some mass awareness campaigns and a recent $2 per pack increase in cigarette taxes. But while a tax penalizes smokers for smoking, it doesn't really offer them any positive guidance on how to quit. And we've reason to believe that smokers in Philadelphia may not be accessing the help they need. In any given year, the majority of smokers in the Philadelphia area will try to quit. But of those that do, 61% will try to quit on their own without assistance. And peer-reviewed studies show that trying to quit on your own without assistance has a very low success rate, only about 3 to 5%. So the question is, why aren't more smokers in Philly accessing the help they need? Well, let's take a look at one way smokers in Philly today can access cessation programs. Facts to quit. Here's how it works. A smoker comes into their physician. The physician evaluates that that person could benefit from a cessation program. The physician then fills out a paper referral form and faxes it to Pennsylvania's Quit Line office. The Quit Line then reaches out and calls the person to see if he or she would like to enroll in a cessation program. Now, we're sure that the Quit Line is very helpful once a person signs up. But this process is a little too convoluted. What if there was a simpler way to help smokers quit wherever they are? And before I go on, I ask you all a question. During this last break, how many of you checked your cell phones? Just a quick show of hands. Today, over 90% of Americans own a cell phone with basic texting abilities. It's pervasive. That's why we believe that texting is a really good way to help smokers quit. I want to introduce you to a novel program called SmokeFreePHL. SmokeFreePHL is a text messaging service that helps smokers quit by sending them regular motivational messages. Developed by experts at the National Cancer Institute, it even has an interactive component, asking you questions such as, how's your mood, and directing you to other resources. SmokeFreePHL has a number of advantages. It's completely free to use, takes a single text to sign up, and best of all, it works. Randomized controlled trials consistently show that use of a text messaging program like SmokeFreePHL doubles to triples the successful quit rate in real-world settings. So, why aren't more people already using it? We believe there's 2 main reasons. 1, many people simply don't know about the program. 2, even if a good option exists, people might not always use it. For example, take something like taking the stairs. Most of us know that taking the stairs is good for you, but we habitually take the escalator. A group in Singapore decided to change that. They painted the stairwells in a public transit system different colors and added a motivational message. And with that simple change alone, over the next month, they saw a 50% increase in the percent of people choosing to take the stairs. What this shows is that even when a good option exists, sometimes people just need a little nudge to use it. That's what we hope to do with SmokeFreePHL here in Philadelphia. My team and I represent SmokeFreePHL. As a team, we see SmokeFreePHL as a great technological solution that could have a real impact on people's lives, but it's not getting into the hands of people who need it. That's what we're hoping to change. SmokeFreePHL will promote SmokeFreePHL among smokers in Philadelphia. We'll do so by promoting it through their employers. Why employers? Remember that $700 million number I mentioned earlier? Here's another one, $5,800. That's the cost an employer faces every year for a single employee who smokes. This makes employers very keen on helping their employees quit. And instead of having to wait for a smoker to come into their physician's office, we can reach smokers every day when they come into work. Our strategy consists of 3 phases: prepare, pilot, and promote. First, prepare. We'll create a set of promotional materials, including flyers, email templates, text messaging templates, that an employer can use to let their employees know about and sign up for smoke-free text. Now, at the same time, employers would like to see how many of their employees are using the program. That's why we spoke with Dr. Augustin, who leads the Smoke-Free Text program at the National Cancer Institute, about creating an interface that would allow an employer to track how many of their employees have signed up for the program and how many have completed it. Here's how it would work. The employer would send a list of employee phone numbers to the smokefree.gov, the NCI's website for smoke-free text. The website would send back aggregate, de-identified data on what percentage of employees have signed up and what percentage have completed the program. Dr. Augustin tells us you can already do this manually. We just need to create the interface that would automate the process on the back end. We envision this functionality as a tab added to the existing smokefree.gov website. Now, once we create the promotional materials and the tracking system, we will run a pilot program with an initial cohort of employers in the Philadelphia area. We spoke with the Philadelphia Department of Public Health, and they recommended we start with a cohort of behavioral health providers that they already work with. This would give us access to a large number of employers at once, and if you can get smoke-free text in the hands of providers, then they'll be aware of it when they talk to their patients. So with this group of initial employers, we'll try out various approaches to encourage their employees to use smoke-free text. For example, organizing a friendly sign-up competition across different departments, offering prizes or financial incentives to complete the program, or even something as simple as asking an employee to write down a commitment to sign up for the program and try quitting. It sounds simple, but the science shows that these small nudges make all the difference when it comes to program uptake. Finally, we'll use the experiences we learned from this pilot phase to create a best practice toolkit with promotional materials and strategies that were successful in getting enrollees to use smoke-free text. This toolkit would be housed at the Department of Public Health for any employer to be able to use it. The advantage of this approach is that it can be quickly scaled to other larger employers in the area. For example, we've been in conversation with folks from the University of Pennsylvania Health System, the largest private employer in the region, reaching out to the mayor's office to try to promote smoke-free text among public employees of the city. The best part is, even after our direct role in this project is over, the toolkit will still be available for any employer interested to use in or beyond the Philadelphia area. Now, how much would this all cost? One of the advantages of SmokeFreePHL is that the text messaging program itself is free to use. Most of our costs would come from labor costs and administrative costs of running the sign-up campaigns. In return, by helping smokers quit, SmokeFreePHL can produce substantial cost savings for the employers we work with in reduced healthcare costs and increased productivity. With the initial employers we've identified, these savings would amount to over $1.7 million in the first year, and the savings would continue to accrue as long as the employee remains smoke-free. Now, while these savings are enticing for an employer, let's not forget what this means for the employee. By working with these initial employers, we can help over 500 smokers in Philadelphia quit who might not have done so otherwise. This means 8 fewer Philadelphians who would die of heart attack, 11 fewer who would die of stroke, and 17 fewer who would die by lung cancer. The bottom line is, most smokers want to quit, and many in Philly are trying, but they need some help. A text messaging program just might give them the support they need. Don't take it just from us. We went on to Smoke-Free Text's Facebook page and found a bunch of positive comments. One smoker said, really appreciate the little text messages from Smoke-Free. Always seem to pop up at the just right time. Another user said, there will never be a day that I regret quitting. Keep doing your thing, smokefree.gov. It's working. It is working. And we want to get smoke-free text into the hands of more smokers here in Philadelphia. By promoting smoke-free text through local employers, we can help more people quit and bring us one step closer to a smoke-free Philadelphia. Thank you.
Can you talk a little bit about, so you mentioned 2 employers, City of Philadelphia and University of Pennsylvania Health System, what the reaction was from them to the initial outreach and the idea and the likelihood that they would help promote this?
So for the initial pilot program, we would not be working with them. We have spoken with them, and they're very positive about it. One of the approaches, so these the 200 behavioral health providers we've spoken to are very interested in helping run a pilot program with us, and we hope that with that pilot program and the success of it, as well as the data that would come behind it showing how many of their employees used it, it would be more leverage to help other employers who already have financial incentives to sign up, just showing that the program will work and would be useful for them.
So have you guys worked through some of the trade-offs between going through, understanding this kind of intermediary role you seek the employers to play, right? It's very handy and very cogently presented. Have you guys thought about the trade-offs between using other kinds of intermediaries in order to kind of organize and connect with individuals, like voluntary associations or, other kinds of things? I'd love to hear a little thinking about, because it's a little threatening potentially for your employer to be involved in this kind of health, somebody who knows what your benefits are, somebody who's paying for some of your insurance premiums and so on. Have you kind of thought through some of the trade-offs?
Yeah, so we have. We thought that employers were a natural partner in this type of endeavor because there have been workplace wellness initiatives in the past that have had great success. We understand that there might be some concerns, and we want to stress, especially with the tracking system, that everything would be anonymous, just aggregate data, not tied to any specific employee. So it's not like your employer would know specifically that you signed up for the program and either completed it or did not complete it. And we also are taking into account, outside of working with employers and working with the Department of Public Health here in Philadelphia, the input from others, including, we have it up here, the Smoke-Free Philadelphia Coalition, which includes business groups, nonprofit groups like the American Lung Association that all collaborate on this type of endeavor in Philadelphia. So figuring out the best ways to get people to try to quit smoking. So we are taking into account other people's feedback, and we would try to present this in a very non-threatening way, and especially one of the ideas that we thought is maybe tying it to something like the Great American Smokeout, just a national type of endeavor that encourages people to quit smoking. So it's not just only work specific, but that we can tie it into something greater.
And if I could just add briefly, so Ben and I actually attended a meeting of the Smoke-Free Philly Coalition just 2 weeks ago and pitched our idea and got widespread support of the idea from more than just employer groups, but some nonprofit groups, some community groups. So I think there's a lot of potential for where it can go. Our approach right now is to work with one set of employers first as a test case to show that this does have an effect and we can get people to sign up, because I think once we have that data in hand, we can get a lot more interest from other groups to just even give us their time.
When you are working with this pilot test, are you planning on evaluating the employees all of them who either were talked to about it or asked to sign up, and how their experience is with the program?
Yeah, so that's absolutely something we want to incorporate, and it's something that we talked about in phase 3 of it. So we want to, in the initial pilot group, include things like surveys of both the employers, like their HR staff, and the ease of implementation, but also anybody who did sign up for the program who'd be willing to talk to us about what appealed to them, what kind of message appealed to them in terms of strategy. So emails, text messages, your more traditional site visits, orientations, things like that, because we are very interested. Because at the end of the day, as much as this is great and we want employers as partners and we want them to help us, this is primarily about getting people to quit smoking, just because the health impacts are immediate, and that's ultimately what we want to do. So if we can incorporate their feedback in any way, that'd be a great positive for us.
And the 550, is that per year? You're expecting to see 550 per year?
Yes, that's correct.
Okay.
From the initial pilot program.
Got it.
Going forward.
Got it.
Did you have data on how many people are actually using the smoke-free text in Philly today?
So we don't have data specifically for Philadelphia. So overall program enrollment is about 100,000 people, which, as you might imagine, given the population of Philadelphia and then how many smokers would be in Philadelphia, means that there's probably low penetration at this point. And that's why we thought that a campaign to get this tool to more people, to make them more aware of it, would be an ideal strategy.
And just to add one clarifying point to that as well, the 100,000 figure, that's nationally, not just specifically in Philadelphia. So we got the number by talking to Dr. Augustin, and based on his knowledge and some other stakeholders we talked to, there's currently no concerted effort to spur adoption of smoke-free text in the Philadelphia area. So he's also very interested to see how this goes.
Could you talk
talk a little bit more about how you got the data on the success of the tech system as it stands right now? How far out does that data go? Is that 1 year after using the program, 2 years? And also, do you plan to incorporate in your first go with this program here in Philadelphia any data collection related to the actual users stopping smoking?
Yeah, so the primary measure in most of the cases with text message-based cessation has been 6-month quit rate, just because that's a convenient number and it's a literature standard in terms of evaluating quitting smoking. We would absolutely be interested in using that sort of data, and that would be part of the tracking system. So as much as we want to just see aggregate numbers for people who sign up and complete the program, we would also be interested in timelines, because what the program specifies is you setting a quit date, and then the protocol follows you from there as if you're going towards that quit date. And there are protocols for if you slip. So if you have a cigarette and need to reevaluate and set a new quit date, it does respond in that way, and the program itself is being constantly updated. But that sort of outcome measurement is usually about 6-month quit rate, and that's pretty standard when evaluating these types of programs.
Help me understand a little bit about kind of the city's conflict on tax policy. Well, one thing you said that the city kind of raves about supporting the aspect of the $2 reduction on cigarette, but yet on the same tax policy they use it to contribute towards funding schools. So just educate me a little bit on, I mean, I understand what you're attempting to do, and I agree with you attempting. I'm just trying to understand on the very next breath, they talk about using this stream towards funding the school system.
Yeah, so we absolutely agree that there is a conflict of interest in terms of the city with the tax, but we do want to stress that it's better overall for the health of Philadelphians and the city's financials if people quit smoking. By decreasing healthcare costs and increasing productivity, that's money that feeds back into the tax system with improved economic activity. And I'd also like to point out that the tax, while consistent with other cities in terms of ways to bring down smoking by raising the cigarette tax, is leaky. You can avoid the tax by, say, skipping into Media or Swarthmore and paying less for cigarettes there, or, for example, in cases where cigarette prices have been higher, there is an increase in black market activity, for example. So what we want to do is increase access to a positive reforce to actually help people quit smoking. So while, yes, right now the city is using it as a source of income for struggling schools, we think long-term that's not something that's sustainable, that it's better to improve overall the health of Philadelphians to make our city better.
That's part of the reason why we want to make this available to all employers. It's part of the focus on public employers, because working with them, they can save, the city of Philadelphia could save far more money through this program than they would by generating through that tax. And then that money could be used for a lot of other things instead of paying for increased healthcare costs.
So I see, some Penn colleagues up on the screen too, kind of aware of some of the efficacy of the texting programs. I've heard David talk 20 times about second heart attacks, right? I don't know if you guys have spent any time interviewing him as one of your key informants, but so it's an incredibly powerful device. It seems like, and I know you had a slide where you were talking about some of the weapons of influence, some of the behavioral stuff you want to do, friendly competitions and so on, and you had a little bit about social media. I think, no, you didn't have. That's actually my question. It seems like, especially when you guys are working, unlike the 1,000 across the country, federal government program, when you're inside a geographically organized community, we know the messages matter, but we also know the messenger matters, right? The trusted messenger, and it seems like a little bit of a. And I know you want to build on an existing platform, right? It's efficient and everything else, but it seems like you have a real opportunity, perhaps, to kind of think more about the social media dynamic that could happen here and the way the messages are conveyed to some of the smokers. It doesn't have to be an anonymous, federal agency, but in fact could be without potentially even tampering with the message. So have you guys thought about some of those things as well?
Yeah, so we have. So some of the positive feedback that we got from Dr. Augustine at the inside is this kind of approach of using employers just because that's where we can reach people where they are. The downside to trying to do social media campaigns for smokers is the failure rate for quit attempts. So most people like to quit, but also most people, the vast majority, fail on their first quit attempt. So unlike something like maybe losing a few pounds or Couch to 5K, some of these more popular social media initiatives that light up everyone's Facebook walls, like, oh, I did it. Smoking is something that doesn't always work with that, just because it is harder for people to get over that hump. If you make everybody aware that you're quitting smoking and then fail, that is hard. And most people will fail, as opposed to most people, if pushed, could run a mile, something like that. So you have to be delicate when doing that kind of thing. So the feedback that we got is that possibly the best way to develop a community of people who want to quit smoking, so they could reinforce each other. And we've discussed that idea amongst ourselves and with Dr. Augusta in the past. If there'd be any way to, say, alter the program to allow only people using the program to send each other supportive text messages, so increasing like your support base, but still keeping it discreet. So you don't have to let everybody, all your friends and family, know that you're trying to quit.
That's good. Great answer.
Looking at like the future, so you start with the business employees. One of the significant impact on getting people to smoke has always been kids. Kids telling their parents, kids telling their grandparents. Have you thought and talking about social media as well with children, have you thought about what would be another way to introduce this kind of plan to members of the community through children?
So that's actually a really good suggestion. I don't think it's something that we came up with ourselves, but we do know that the Department of Public Health is currently doing a number of initiatives beyond just kind of delivery of cessation services, and one of them is an ad campaign where it includes a child who says, "I thought you were going to quit. What happened?" So kind of leveraging that, and I think that the general premise is that what we hope to do with our program is to mesh it with the current efforts that the Philadelphia Department of Public Health and the City of Philadelphia are doing, because the core of our program is to get people to know about and use an existing program. So if we can tie that onto anything else, that would be great. As one example, just over the last 2 years, the Philadelphia Department of Public Health has been doing a public detailing program where they train primary care physicians to be able to essentially identify and refer patients who are in need of smoking cessation services. So I think getting something like this in front of providers would be a very complementary resource, one of the many that they could offer and direct smokers to. And in fact, the Department of Public Health in their annual report said that one of the next initiatives they want to focus on is to take that detailing program from primary care physicians and expand it to behavioral health providers in the city of Philadelphia. So I think our initiative with the initial cohort pilot would actually mesh really well with that.
And I will note that, as you may imagine, a program based on text messaging, the initial target demographic was teenagers. It's since been expanded outward because of the success and the now ubiquitous nature of cell phones. But yeah, that was an idea that was even thought of at the initial stages of conception for this program, is early adopters are always the people who are most wired in. So
was it built originally for teenagers to stop them from smoking, or for them to push to their relatives?
It was originally focused on teenagers who wanted to quit smoking, yes. But part of the development behind this program, and something that's appealing, is that it's constantly updated, including things like the messaging libraries and the different protocols for if you respond and say, "I'm having a craving." So that's been broadened out, and it's now available, for example, in Spanish as well. So it was initially designed for people who were texting, and now everybody's texting, so it's now designed for everybody.
Last question.
And how about the role of insurance companies? I know you mentioned in the write-up that there are different programs. I know Blue Cross has one. It seemed like they're a huge part of this, a vested stake, but I didn't hear you talk too much about it in your oral presentation.
Yeah, so insurance companies are, in our mind, one of our greatest strengths for funding. Like you said, Independence Blue Cross currently has a smoking cessation initiative where if you participate in this program and you finish the program, they'll incentivize you by giving you $150 for finishing the program. So we found that to be exactly in line with our mission, and we thought that working with these insurance providers could help us figure out a way to also help fund this program. The costs are minimal, which is one of the benefits of the program, and the costs that the savings that the insurance providers can find. It's one of our greatest strengths, and yeah, we're definitely working with them too.
Yeah. And our Ryan, who's been helping us out from the Department of Public Health, he's actually connecting us with one of his contacts at the Independence Blue Cross. Thank you so much for your time.
Thank you.